On a good note, the resiliency of the Springfield people and business community and my tested and true cabinet heads down the rank and file kept us going 24/7, and we did come back. Old First Church is where Springfield has gathered for many, many years, dating back to the 1700s, 1800s. Those bells will toll at 4:38, and I'll be on City Hall steps to witness that. We also, it's been a tough past week and weekend for the United States of America, and we'll also hold a moment of silence for George Floyd, what unjustly occurred to him and his family. And in the middle of that, we need to continue not to forget we are dealing in defeating this COVID-19 coronavirus. This is still going on. We have worked so hard to knock the numbers down, and you will see that in numbers that I will report, and that Nancy Schindel Falick, who is the president of Bay State Medical Center and senior vice president of operations for Bay State Health, and Dr. Robert Roos, who is the chief medical officer for Mercy and Trinity, will report. And I'm so thankful that they are here today. And the format is now after they speak, because they need to get back to the medical operations, hospital operations. The press will be able to ask questions at that point in time. On a personal note, it's my mom's birthday. God rest your soul, Mom. Happy birthday, June 1st. I'll visit you and Dad later on that. I'd like to also state that pertaining to what has occurred to George Floyd, and I issued a letter to the editor this weekend, the cause, the message must continue to be about what unjustly occurred with George Floyd. We honor and respect peaceful protests. We had a peaceful protest Friday afternoon in front of the Springfield Police Department, in which our police department did a very, very good job, as long with the protesters too. But we're not talking about that now. What we're talking about is the few, or the small percentage, of not protesters, but rioters that are bringing disorder to the message and the cause, which does not honor Mr. George Floyd, his legacy of change. And that cannot be lost or forgotten. All of us agree, of all creed, colors, and backgrounds. We've all rallied that what occurred was atrocious and unacceptable. So there's no argument there at all. So I ask all to be cognizant and be aware of the few, whether here in the city or other states or in America, that are disrupting for their own causes, because that cause is not the cause, the proper remembrance the George Floyd and his family. Pastors have reached out to me. We've established very good relationships in the past years, and they've reached out wanting to do a prayer service and uniting together, and I look very much forward to doing that. So at this point in time, if we can just hold a moment of silence, first of all, for the COVID-19 coronavirus victims and families, especially of those in the city of Springfield. A moment of remembrance marking the devastating EF3 tornado of June 1st, 2011. A moment of silence for George Floyd and his family and friends. And a moment of silence for my mom, Clara Sarn. Thank you very much. Just some brief updates before I turn it over to Nancy and Dr. Roos. New cases, and again, the numbers seem to be trending in the right direction, and Commissioner of Health and Human Services Helen Carlton Harris will speak more about it. But Friday we had 39. Saturday we had 20 new cases. Sunday we had 18 new cases, which totals for 2,400 cases total in the city of Springfield. That encompasses about 6.2% of the state's number and encompasses about 39.6% of Hampden County. Unfortunately, in deaths, we went up to 101. That is 1.75% of the state and 17.41% of Hampden County. 53 of these deaths, and again, God rest their souls, and my sympathy and thoughts and prayers to their families. 53 are long-term care facilities. 48 are residential. The makeup of the breakdown is 52 that are white or Caucasian. That's 51.48%. African American or Black is 21, which is 20.79%. Hispanic, Latino, Latina, or Hispanic is 27 total, which is 26.73%. Asian is 1, so it is the percentage of less than 1%. Elder Affairs, we've delivered to our seniors who are in need and requested 8,148 meals. I believe today we'll have another 150 meals being delivered to our seniors in need. Lieutenant Governor Karen Polito had called me early this morning to check in and any needs that we might have dealing with COVID-19 and how we're doing with any type of peaceful protest or any type of issues arising. We did get a call. I did get a call last night, and I appreciate Commissioner Cheryl Claprud from the state leaders that they were calling in a National Guard and needed some of our people who were in the National Guard, and what occurred, unfortunately, in Boston, which, by the way, that was a beautiful crowd there. Beautiful crowd there in Boston. Thousands and thousands and thousands of people. Quite a message on the cause of George Floyd. And then they have that circumvented by a few or a number, some from the outside, that started all that negative situation. Was absolutely terrible. As far as facilities and parks, Pat Sullivan continues to work on the reopening aspects of Phase 1 going into Phase 2. We had a good first week of reopening. You know, the feedback was good. This is a new normalcy we're in, and we work out the kinks, but it went very well. We continue to work following CDC guidelines and Governor Baker's edicts on his phase-in approach pertaining as we continue to look and review our summer programs to see what can or cannot be done. On finances, TJ Plant, my CFO, reports to me revenue loss again is $3.4 billion, and we have spent 5.6 in deficit spending to continue to provide for our residents and business community in need. And as I stated before, past natural and man-made disasters, I will go after every dime I can get my hands on from FEMA, the federal level, state, any and all agencies for reimbursement for the city of Springfield residents and business community. Commissioner Clapprood, who I alluded to earlier, they're down 3 police officers due to COVID-19 coronavirus. Again, as I commended the protesters, I commend the police department. The peaceful protest went very, very well. We had hundreds of people in front of the police department Friday afternoon. I was on site monitoring also. They're doing a debriefing on that and also continue. Other departments in the area have reached out to Commissioner Clapprood on our efforts. I spoke about the National Guard call-up. And again, the pastors have reached out. I look, as does Commissioner Clapprood, forward to doing that prayer service ASAP. ASAP. So we'll follow up on that. Commissioner Calvi indicates from the fire department they're down 2. They're in pretty good shape, and I appreciate their efforts. Chris Signoli, DPW, they're down 2. Things are going okay, going fine. He continues also to work with Ed Pakula and Tim Sheehan on the restaurant reopening. And we're waiting further directives from Governor Baker, but we want to get our restaurants rolling. We assume it's going to be al fresco outside as soon as possible, so already we have been working on the guidelines. Schools, Superintendent Dan Warwick, we're up to 954, 800, and 800. So we're going to reach 1 million meals. 1 million meals served by the middle of the week. That's breakfast, lunch, dinner, and snacks. I understand in some areas of the country, some of those processes have been disrupted with some of the protests that have gone on. We're hopeful it doesn't occur here. About 74,292 meals went out just this weekend. Virtual graduations start tonight. And if you're in Springfield, it's on Focus Springfield Channel 15, 6 p.m. And the school department's also going to live stream those virtual graduations. And they run from this week and going into next week. Superintendent Warwick and his team continue to work on summer remote learning. We're putting more money into that for remote enrichment to all of our students. Director Tim Sheehan, Chief Development Officer Tim Sheehan, again, continues to work very feverishly on the restaurant reopening. And also something that we were working on, and I appreciated Tim, and we're hoping to announce it this week. Besides the businesses, need to continue to help my residents. They're struggling. So we've been able to put together $2 million working with HUD. This is to bring, following guidelines, to bring relief to our residents for rent, mortgage payments, and utility payments. And we understand a very reputable firm, we'll announce later, but the Wayfinders, who has a great track record. So we look forward to giving the specifics of that later on this week. The Oasis Food Pantry, another one to help our residents of the area, nearly 3,500 families every Friday at Central High School. A tremendous amount of food, working with Sedesco also, and the Food Bank of Western Mass, and also the milk dairy providers. They're giving us their milk. And Jim Validi's 90 meat outlet has been great to make sure that we're able to give out meet and get tack. Commissioner Clapper, that's our body worn camera consultant or company. They donated 400 surgical masks that we can use to continue to give out to the public. Ed Pakula, again, on all legal aspects, but he continues to work very closely on this restaurant reopening aspect. Bill Mahoney on our continued protecting and preserving, my attorney for labor and HR, protecting and preserving our workforce. He gave me some interesting numbers on unemployment, and we were doing very well here in the city of Springfield. At the time, unemployment in the city of Springfield was 4.4% in March. With the pandemic occurring, the unemployment in Springfield is in April's numbers, 20.3%. Statewide, April's numbers 15.1%. So again, this has been a delicate balancing act to move us forward in a smart and efficient way, but basing it on public health, medical, and sciences, but also balancing that we need to get reopened and get people back into work, and then balancing it, working closely, very closely daily with our hospital system, because when and if there is a surge, the hospital capacity is key, and they're well positioned if there is a surge on that. So we're moving in the right direction. There is light at the end of the tunnel in defeating this COVID-19 coronavirus. And just as importantly, as we need to continue to come together as one for the cause of George Floyd, for that cause, to continue to make us a better Springfield, a better Massachusetts, and a better America. And that needs to be the precise, pinpoint effort in properly honoring George Floyd's life, and then moving forward on the legacy of change, what occurred with him in Minneapolis, Minnesota, and mutual respect, and understanding with our residents of all backgrounds and our brave and dedicated men and women in blue. I know we can and we will be able to accomplish that and build bridges. With that, I'm going to bring up the president of Bay State Medical Center and senior vice president of operation Bay State Health Systems, Nancy Schindel Palick, and we cannot lose sight. We still have to defeat this COVID-19 coronavirus. Nancy, thank you so much. Great shoe boots, too.
Thank you, Mayor Sarno, and thank you to the media for continuing to focus on COVID-19 and help us share our updates with the community. And just as we were prepared for the tornado 9 years ago to help in the devastation, Bay State Health and Bay State Medical Center are here for whatever the community faces. So across Bay State Health, here are the latest numbers. We have tested a total of 13,670 people. 1,754 were detected positive, which is 13%. Not detected were 11,859, which is 87%. And deceased are 215, which reflects 12%. Our numbers across the system at all Bay State Health Community Hospitals and Bay State Medical Center continue to trend down. Currently, we have 44 cases with 9 in critical care. Last week when I was here, we had 63 total with 19 in critical care. So we were very pleased with that steady decrease. And COVID now represents only 8% of patients that we are caring for at Bay State Medical Center on 3 distinct units, comparing to about 92% that are non-COVID patients on 20 distinct units. So we are caring for a total of 600 patients, which represent all specialties and services. Our behavioral health units remain fully open, and we are seeing increased numbers seeking care across our system. We continue to offer experimental treatments with over 30 COVID patients receiving remdesivir and over 40 patients receiving convalescent plasma, and our 2 clinical trials continue with a monoclonal antibody and hydrochloroquine. Overall, over 1,000 patients have been hospitalized with about a 20% mortality from COVID. And to date, of the 215 that have died from COVID, we have analyzed 182 where we have all of the detail, and we do not see that minorities were disproportionately impacted. So in our caring for patients, 7 were Black, 3 Asian, 21 Hispanic, and 151 white. Aggressive outreach and testing is really necessary to combat in the long term, and we are working and increasingly focused on high-risk neighborhoods where there are vulnerable congregate settings, and that we can relate based on our Medicaid ACO. We have community health workers reaching out to patients. We have medication and grocery deliveries to those in need. And we have provided cell phones so that as we connect with patients and monitor their systems, they have the minutes to be able to interact with our providers. Our goal is to test 1,000 patients each day, and efforts continue to evaluate platforms so that we can reach this goal. Beginning today, Bay State Health will be testing those in custody with DCF, the Department of Children and Families. Additionally, anyone whose provider wants them tested can have an order for testing, can get an appointment and come to one of our centers for same-day testing. Once again, I want to assure you that all Bay State Health hospitals are ready to care for you for any reason, and we have made the essential changes to ensure your safety, including COVID and non-COVID care zones. We are facilitating social distancing through deliberate attention to schedules and use of technology to promote the maximum safety. And we have strict protocols for cleaning and sanitizing all of our facilities. In our outpatient areas, we are expanding services consistent with Governor Baker's reopening plan. We are ensuring that all 100 of our practices in 20 locations are consistent in the use of social distancing, disinfection, and masking. We will continue the use of telehealth and digital technologies to minimize time in waiting rooms and ensure social distancing. As society opens up bit by bit, we will continue to move forward only if we continue to observe preventive measures, including social distancing, masking in public, and hand washing. We are not going back to our previous normal, but things will get better if we are all committed to doing our part. I serve as the hospital and health system representative from Western Massachusetts on the governor's calls, and there is focused attention on opening up the economy and also ensuring that we as citizens of the Commonwealth are safe and can get here care if needed. Bay State can expand its capacity to respond to the need should a surge arise, and we are here for you. So thank you for practicing prevention to help us move forward. For more information, please visit baystatehealth.org. We continually update our website as this is a dynamic and changing situation, and we want to provide the latest information. And I thank you once again. Thank you, Mayor, for the opportunity to speak with you, and please stay safe.
Thank you, Nancy, very much. Before I bring up Dr. Robert Roos, the Chief Medical Officer of Mercy Trinity Healthcare, I also want to thank the lovely ladies, our sign language ladies, the trifecta, as I call you. Thank you very much for being here. And Patrick Leonardo, who has been our partner with AMR, the ambulance services, and has partnered with us with our homeless, continued homeless attack to keep that vulnerable population with Bay State and Mercy doing well. So with that, Dr. Robert Roos will now come up and give the update perspective from Mercy Trinity Healthcare. Doctor?
Good morning, and thank you, Mayor, for all that you're doing, and thank you to the media as well for continuing to provide excellent reporting during this tough but important time. I hope everyone had a nice and peaceful weekend. We are clearly living in some unprecedented and some unsettling times. And I want to commend you, Mayor, and your teams here in the city of Springfield, particularly Commissioner Claproot and her officers, for upholding public safety in an honorable way, as public safety is always connected to public health. And it's particularly notable in these times that are coming with great challenges. Last week, I voiced that COVID presents us all with a societal challenge. And as I see it, a calling to protect one another, to preserve each other's livelihoods, and to promote public health, civic responsibility, and community solidarity. And this week, that calling to come together positively, as the mayor has said, and in solidarity became ever more apparent and relevant. We have two crises in this country: a pandemic caused by a novel coronavirus that we've been battling for 4 months, and an epidemic of systemic racism and violence that's led to social and economic inequities, health disparities, and preventable death for generations. And as we've seen over the past week, these two crises are unfortunately colliding in some cities across the country. And both crises are at risk of causing more destruction together if both the present circumstances and the underlying conditions are not addressed. As someone committed to health and healing, these crises are both of great concern to me, and my heart goes out to all of those individuals that are impacted by them, and I applaud and stand with the courageous members of our community who are committed to improving those conditions together. In regards to COVID, the path is relatively straightforward. We know what we need to do to heal ourselves. We can treat and we can test. We know what we need to do to mitigate its spread. We can employ preventive measures like universal masking, hand hygiene, and social distancing. And we know what we need to do to prevent in the future as we develop safe and effective vaccines. It will not be easy, and it won't come immediately, but we know what will work. And what you and I do today will directly influence what we can do tomorrow, next week, and in the future. And the science and the data at Mercy continues to show that our efforts are showing positive results. In terms of hospitalized patients today, we have 13 patients with confirmed COVID infection and just 3 in our ICU. And consistently over the past several weeks, we've had less than 20 confirmed or suspected cases at Mercy. And so now we've had 7 weeks of declining numbers and 4 consecutive weeks of declines in the percentage of our medical surgical patients, now down to a nadir of about 10%. In regards to testing, we've tested over 11,400 individuals. with nearly 2,500 positive tests. But the percentage of positive tests has also continued to decline now with 4 consecutive weeks at less than 15%. And in fact, over the past week, we are now just averaging about 6 positive tests per day at Mercy Medical Center. And so, in regards to the other crisis, at Mercy, we're focusing our efforts on healing and addressing the conditions that could lead to racial and ethnic health disparities. We know that across the country, that minority groups have experienced hospitalizations and deaths at higher rates than others. But we too, like Bay State Health, have not seen that amongst our deaths at Mercy Medical Center, largely because of, I think, the efforts that we've collectively put in to address them. Throughout this pandemic, we have worked with our Community Health and Well-Being Department to provide direct outreach, homeless care, and education to community members about COVID-19 and its impact on different populations. We have worked through our accountable care organization, BMC Mercy Health Alliance, to do outreach to individuals with Mass Health, and through our clinically integrated network, Soho Health, to all members regarding testing, symptoms to watch out for, and where one can receive care. We have partnered with the City of Springfield and others to provide testing for our homeless population, and we've provided infection control expertise and guidance to our partners in the correctional system. We have educated our provider teams to the disparities and outcomes that exist, and we continue to offer the latest evidence-based treatments and those that are under investigation, including remdesivir and convalescent plasma, to all comers without discrimination. We have provided both surgical masks and cloth face coverings to people we serve that may not have access to them to keep and reuse. And we've provided resources such as housing and made connections to available food, community resources, and childcare for those within our organization that have needed it, and also those in the community to help reduce the impact of COVID on people's lives. All throughout our history, Mercy Medical Center has been guided by its calling to respond to the needs of the community, and that will not change. We carry the core values of reverence, to honor the dignity of all people, and justice, to foster the right relationships to support a common good. And we will continue to focus our efforts on all people that need it. That goes for this health crisis and any crisis. And so with that spirit and with all the efforts that we've put into place to keep you safe, today Mercy Medical Center is attesting to the Department of Public Health's reopening criteria to be able to expand the services and procedures offered to you. We know that these are early days in phase 1, and we have a long road ahead, and one that's going to come with significant and additional challenges. Yet it's with these efforts, it's with these care safeguards, it's with the continued focus on physical distancing, hand hygiene, and following our data that will support us moving forward together. And so let us be reminded again that together we have flattened the curve of this virus. Together, we have acquired the PPE for our direct healthcare workers. Together, we have expanded testing dramatically and outreached directly to at-risk, marginalized, and disenfranchised communities. Together, we have developed treatments, and we are studying their effectiveness. And most importantly, together, we have remained ready, committed, and prepared to provide care for our community and do it safely, equitably, justly, and with great concern for the health and safety of everyone. So thank you for being in this together and for helping us to emerge stronger.
Thank you, Dr. Roos. And Madam President, if you want to come up, and Dr. Roos, and so they can get back to their important work. And I cannot thank both Bay State and Mercy, all your direct line healthcare providers, from doctors up and down, all the way to your CNNs and facilities management. You've been on the front lines. And you've seen a lot of challenges, but you've also seen a lot of people recover because of your efforts. So let's give them a big round of applause. Absolutely. Thank you. So now, for the press and the media, and again to the media and the press, thank you so much for always getting, whether being here or getting our information out, that is so valuable to our viewing public for public health. So now we'll open it up to questions for Nancy and Dr. Roos. Paul?
Dr. Roos, are you concerned that these protests that we're seeing all over the country with thousands of people together will spread the coronavirus?
So we do know that the social mitigation efforts, including physical distancing and not gathering in large groups, has been one of the most effective strategies to reduce the transmission of the virus. So whether it's recreational events or peaceful protests where there are large gatherings of people coming together, if there are individuals that could have the virus, it does present some risk that could increase the transmission or cause a spike in the number of infections. What I would caution people is to continue to take all the other appropriate measures that they can in any circumstances, including wearing masks, practicing hand hygiene, and we will hopefully look to not see that occur in these situations. But there is a potential that these two things can intersect and cause more harm together.
Any other questions? Matt? That's all right. Go ahead, Matt. Go ahead, Matt. Mike, go ahead.
Are the COVID risks now any less than in March when the lockdown in the pandemic began?
So I think the question is about, are the risks now less than they were in March when the initial lockdown occurred? Well, when we look at the risks of transmission of the virus, we have to look at the numbers of people that are in the community that have virus that could potentially be transmitted to others. As that prevalence rate decreases, then the rate in which that could spread to others certainly decreases in parallel to that. So as the percentage of positive tests decrease and the prevalence of active coronavirus in the community decreases, we should continue to see less risk with increasing types of activities. And that's what helps guide the phased approach to reopening. So looking at the data, where we are today or where we were 2 weeks ago is significantly improved with less risk than where we were here in this community at the beginning of April, where we were seeing a peak of infections and illness in this community.
Madam President, if you want to address anything at all?
I would agree, and I would say that we want to be optimistic that we are seeing decreased risk. We also know testing is really the key. And so the need for us to really test all citizens and know their status cannot be underemphasized. And I know, as I shared last week, Governor Baker's plan is that by the fall, we're testing 30,000 patients a day, and by the end of the year, 50 to 75,000 patients, and that will really give us the insight that we need to really understand risk and how we move forward.
Thank you, Nancy. Any other questions?
Nancy,
Matt?
a question for you. You mentioned hydrochloroquine being used, but there's increasing concerns about its safety. Several countries have banned its use, and even the FDA seems to be advising against it. I suppose the question is, why is this study still going on if there's so much concern about its use in this country?
So once we begin, so the questions related to hydrochloroquine, and we are continuing the study. We will complete the study. We will not be surprised if it is not demonstrated as an effective treatment, but once the clinical trial begins, we will see it to its completion.
And a question for both of you. Are you noticing at all a change or an improvement in the turnaround that people who are hospitalized, but obviously don't die, being hospitalized for COVID, is the amount of time they're in hospital, has it decreased over the course of time?
Actually, when we look at our patients, the length of stay for those with COVID is longer than it is generally. And so we have not analyzed, are we faster or better today? I know that when we look at all of our general med-surg patients, and that includes intermediate care, which is a higher level than general med-surg, we see about a 7.5 day length of stay. And for those in critical care, a little over 13 days, and that's on average. Some patients are faster and some patients are slower.
And one of the things about this pandemic is that we continue to learn day after day, week after week, and as has been discussed here before, both with Dr. Kerouac previously and myself, is that the strategies that we have employed to help treat people has changed over the course of this pandemic. So we have more targeted approaches to help keep people off ventilators and out of intensive care units, and we had wider access in the past couple of weeks to the use of convalescent plasma and remdesivir. In our case, while it's not a study that we're doing necessarily, it does seem to have resulted in less patients in the ICU, less long lengths of stay in the hospital, and potentially in some cases more patients being discharged. So those are all positive signs as well. This morning, Trinity Health released an update to its treatment guidance for hospitals across the country that did remove the use of hydrochloroquine from any use within the facilities. And so as of today, and really had been the case over the past several weeks, we are no longer using that medication as part of our treatment protocols.
Any other, Mike?
For either of you. Are you seeing more young patients with that COVID-related illness and the rash associated with that? With those patients, have you had any, are you seeing any change in symptoms with this condition?
I can speak for Mercy. Not having a children's hospital, we have not seen any cases that I'm aware of the multi-system inflammatory syndrome related to COVID-19. So, can't comment on.
We have seen a couple of cases, and the children have all recovered.
Any other questions?
Just another one for both of you. As we start reaching a point where it's reasonable that there will be periods of time where your hospitals have little to no COVID patients, is there an idea about how that's going to change operations where, you know, and one thing I imagine you're going to be testing everybody who comes in, you know, but on the other hand, you are going to have a lot of hospital that is set aside for a disease that doesn't have as many people. I don't know if you just want to comment on what that's going to look like when you're going to have very, very low numbers of COVID patients.
Yes, and I think we will be thrilled to have lower numbers of COVID patients. However, we know that we don't know how this virus behaves and what the fall will bring. And so we will plan, and we have already closed units when there are not enough patients requiring care. That said, we have kept our surge capacity so that we are able to respond and care for any patients that need us. So we will expand and contract as our numbers do.
Thank you, Nancy. Dr. Lewis?
And I would echo that. As Nancy alluded to earlier, we want to be optimistic about this, but always prepared. And so we will continue to operate at the hospital with COVID-free entrances, walkways, and units, and have dedicated and cohorted COVID spaces for any patients that would come through. If we get to a future state where we have such few numbers and they are so infrequent, perhaps as a result of an effective vaccine, then we may at that time consider treating COVID as we would with other infectious diseases like tuberculosis, where we have strict protocols and procedures to employ within the context of usual or the new normal of care. I think we're some way off from that. And so for now, I think for the foreseeable future, we will continue to operate as we have constructed to ensure that care is as safe as possible.
And just one more question for you, doctors. I know I can ask this a little bit 2 weeks ago, but it was more in the context of people who are currently receiving mental health treatment. So I'm asking this more as, you know, mental health professional opposed to chief medical officer. As we begin to open up, people are going to be going on, are going to be dealing with a very broad mental health crisis, you know, throughout the world, not just here. But do you have any thoughts about, you know, what we should be prepared to see as far as that goes, and what we need to do to address that
think this is, so thank you for the question. I think this is really still an emerging issue. I know during this pandemic, it has come with great unsettling times and has created tremendous anxiety in certain individuals and throughout the community. It's also created great loss, which can create grief and depressed mood in others. I think what we know is we've also developed new ways of reaching out to people throughout this pandemic and transformed how we provide care and support to people that are struggling with mental health or substance use disorders throughout this time. And I think it's going to be essential now and into the future that we continue to keep a close pulse on people in the communities and continue to transform how we deliver that care to best meet those needs.
I agree with Dr. Roos's comments, and I'm pleased that in our primary health settings, we do also offer behavioral health support, because it is true, we don't know what the long-lasting effects will be, and we do know that people have a different tolerance level for how much stress they live with every day. Some people can move on quite quickly. Other people seem almost paralyzed or devastated over this COVID crisis. So it remains to be seen, and I think what we want across Bay State Health is that we have early intervention wherever possible to help people deal with whatever they're facing, or their anxiety or depression or changes that they're experiencing due to having lived through COVID.
Thank you. Thank you very much.
Thank you, Mayor.
Thank you.
Dr. Roos, and appreciate everything you and your team are doing. Thank you. Stay healthy, stay safe, and thanks for your efforts, Bay State and Mercy. Now we'll give you the updates from my cabinet heads pertaining to the city of Springfield, and my point person has been Helen Colton Harris, the Commissioner of Health and Human Services. And like with all my cabinet heads and rank and file, they've really done yeoman work in combating and moving to defeat this COVID-19 coronavirus. So without further ado, the elegant and eloquent one, Helen Colton Harris.
Thank you, Mayor, and once again, thank you for your leadership. I want to start by congratulating the residents of the city of Springfield. You are doing an amazing job. We've asked you to do something that you've never had to do before. We've asked you to stay at home. We've asked you to socially distance. We've asked you to wear face coverings. We've asked you to practice good hand hygiene. We've asked our businesses to behave differently. We've cut down on the number of individuals you can have in your businesses. We've asked you to wear face coverings. We've asked you not to let individuals come into your stores without face coverings, and you are doing it. I am extremely appreciative of the work that is being done by our residents and our businesses to control this virus and to contain this virus. 101 Springfield residents have died. 101,711 Americans across this nation have died from coronavirus. We continue to see the community spread from coronavirus. So while we are very grateful for the efforts that have been done by our residents, we ask, as you have been asked many times, to stay vigilant, to continue to do those things that we know will protect you, your families, and each others. The mayor indicated our numbers, the city of Springfield, 2,400 positives, 39.76% of the Hampden County cases. The new cases in the Commonwealth yesterday were 664. And the long-term care facilities in the Commonwealth remain high at 62% of all deaths are from long-term care facilities. The Commonwealth of Massachusetts is working vigilantly with the long-term care facilities and have had med techs and National Guard med techs in long-term care facilities. We continue to work closely with our long-term care facilities because we understand that losing a loved one, no matter what the age, is a travesty and leaves a gap in a family. And so we continue to work with our long-term care facilities and pray for the residents whose families have transitioned or passed. 52, as the mayor said, of the 101 who died in our city were white, 21 were Black, and 27 Hispanic, and 1 Asian. We continue again to ask you to work with us and continue to do the work to defeat this virus. The face coverings, working, social distancing, working, staying at home if you're sick is working, and hand hygiene again. I woke up this morning really understanding, as it had been mentioned, there are 2 pandemics that are going on. Dr. Roos mentioned the coronavirus, and we know our path there. We also understand that violence is a public health issue. In 1984, then Surgeon General C. Edward Koop stunned America when he said that violence is a public health prevention tools we should use in order to combat it. So it is public health prevention and intervention. And there are 3 or 4 phases to that. One's the individual. The other's creating relationships. The other is the community, and what we're seeing is really societal. Looking at those broad societal factors that help create a climate in which violence is encouraged. Factors include social and cultural norms that support violence as an acceptable way to resolve conflicts. Other factors include health, economic, educational, and social policies that help to maintain economic or social inequities between groups in society. That is the public health language. What we saw with George Floyd is really just a symptom of pulling off the bandage on a wound and understanding that under it was festering. And so there's so much anxiety, so much depression, so much concern, so much unrest. And it has to do with George Floyd, yes, but he is the latest in a number of social inequities under that public health prevention umbrella that have happened in America. America is reacting. America is really understanding that we have to put those strategies in place to be able to do good prevention and intervention. In our world today, there are two crises that are public health. One is the coronavirus, and we're working on that. The second is the public health violence prevention strategies that we all should be thinking about, but we cannot forget the last part of that social compact I just said around public health, and it says again, to maintain economic or social inequity between groups in societies. Those policies that help to maintain those are the things that we need to collectively work together on in order to build the Springfield and the society that we want. I woke up this morning really not understanding where I was. I was watching television, and all of us watched the looting, the deaths unnecessarily that we were witnessing. And once again, we had to say, where are we at this point in our lives? Michelle Obama said, movements for real and lasting change are sustained by the relationships we build with one another. That's what I'm asking, that we build those relationships around coronavirus, and we build those relationships to address those social inequities that are a part of the public health umbrella. I am grateful to Mayor Sarno for his support in calling groups together so that we can have these kinds of conversations that lead us to a more peaceful and equitable relationship with each other. We must continue on that path together because, quite frankly, it's painful and hurtful to see what's happening in this country right now. And together, as Michelle Obama says, those relationships we have with each other will sustain us. Thank you.
Thank you, Helen. So well put. Thank you, Helen, so much. You can see why I say the eloquent. That was so well put. And this past Saturday, we were able to go back to our houses of worship, whether church or synagogue or mosque, and I was able to get back to my beloved Mount Carmel Church at 4 o'clock Mass Saturday, and not only to pray for my family, but also to pray for my family of you, Springfield, and to pray for each and every one of you, and just as importantly, to pray that our nation can learn and heal from this process of change. So, Helen, your words are warmly received and much deserved. With that, we will go into our public safety component, and I'm going to lead off today with Springfield Fire Commissioner Bernard B.J. Calvi. Again, they were out putting, I think they had 3 fires, made aware, 3 fires that they were out putting out over the weekend, and we deeply appreciate our brave and dedicated firefighters. Springfield Fire Commissioner Bernard B.J. Calvi.
Morning. Thank you, Mayor. As the mayor stated, we had quite a busy weekend. We had 3 building fires yesterday. We had a major motor vehicle accident on Saturday. We had a large brush fire on Friday afternoon. We had 2 other structure fires last week and brush fires and multiple burning complaints. So with everyone being at home, being out of school, if everybody could use extra care when being out in the outdoor areas with disposing of cigarettes, keeping an eye on younger individuals in the community, make sure they're not getting into mischief, starting fires out in the woods. Just keep an eye on that type of thing. One of the building fires was started due to someone disposing a cigarette in the mulch outside the building, which spread to the building. So if we can all keep an eye on that, that would be great to help eliminate and keep the fires down in the community. On the COVID front, we have currently 2 people out from the department with COVID-type symptoms. They're being tested now, and hopefully those will be negative. We can get them back into the workforce as soon as possible. That's my report for this week. Thank you very much.
Thank you, Commissioner Calvi, and now I'm going to bring up the Police Commissioner, City of Springfield, Cheryl Clapprood, and again, her men and women in blue did a tremendous job on the peaceful protests that occurred Friday afternoon, and we welcome peaceful protests. I think what all residents, no matter what creed, color, or background, or business community, do not welcome is the few that want to cause negative activity and violence. So while we welcome peaceful protests, we will not welcome any type of criminal or disorder. So no one, whether police officers, whether the protesters themselves, whether the residents of the city of Springfield, or the business community of the city of Springfield, has to face any type of negative activities. So again, I'm proud of the police department and how they continue to move forward and build relationships and how we handle that situation. And I'm proud of the protesters. And I've indicated that in writing, too. That it was peaceful. We heard your message loud and clear. And that's the proper way to honor George Floyd's legacy as we move forward for positive change. And as Commissioner Helen Colton Harris has indicated, building bridges, working together. There's been too much of this going on. We need more of this. We're not always going to agree, but if there's mutual respect, there can always be an understanding to get to that goal. So without further ado, the Springfield Police Commissioner Cheryl Clapper.
Thank you, Mayor. Good morning. We have 3 officers out with COVID. We have had, I think, 5 now called up to assist the National Guard, which we understand and we can handle at this point in time. The state is busy as well as the city. I would echo the mayor's comments in that Friday's protest out in front of 130 Pearl Street went about as well as can be expected. I do also compliment the organizers of that protest in helping us de-escalate some people who were becoming agitated, and we needed their help. I do not look for any confrontations with any group. I understand their point of view. As I said in an interview Friday, and I will repeat again, and it's not an excuse, it's for public understanding, to please know that as frustrated as the public is in the incident regarding George Floyd, we also are frustrated. We also are angry. We also are confused at what happened and the focus on us as a whole, because the police department has worked hard to build community relations here in Springfield, as I'm sure police departments across the state have. We know we cannot work in a silo, isolated. We need the community. We do not succeed by ourselves as law enforcement or protecting the community of Springfield. We need the community, and we had made such great strides here in Springfield with our C3 and with the new officers coming on board and with the training that they received, the EPIC training. And EPIC stands for Ethical Policing is Courageous. And we teach that to the new recruits, and the mayor knows that the last group of officers who were promoted, I told them what it takes is courage. Not courage to fight against crime, but courage to hold yourself and others responsible for actions, so that if one officer is acting out or one officer seems to be a bit rogue in their behavior, to report that, to let us know that. That takes courage, because the police department is a big group of people who have our own internal struggles and issues as well. And peer pressure from older officers can be exerted on younger officers, and hence the old saying of the blue wall of silence or the blue line of silence. We can't have that anymore. We need a blue wall of courage to do the right thing, and that's what we stress in Springfield as they're stressing across the state. So no one is more frustrated and more aggravated at the events that took place in Minneapolis than the police. And I have said it before, no one hates a bad cop more than a good cop, because we get lumped together, and the strides we've made, the accomplishments we've made, gets dragged down as well as that of the bad cop. So we hate to see that. The act was egregious. The act was indefensible. Police chiefs and departments all over the country have spoken out against it, and there's nothing more that we can do at this time for that act than to wait for criminal charges to take effect. And the officers were fired, and rightfully so. So what I ask the citizens to understand at this point in time is, please understand that the officers are in a circumstance that pretty much amounts to a tinderbox. It's a powder keg of emotions. You had officers who are afraid and scared of COVID. We don't want to bring that back to our families. You have officers who are trying to enforce new orders and regulations regarding masks and social distancing. And we find ourselves placed in the role of being the person on the playground that says, no, don't do that. Remember that you have to wear masks. Remember that you have to socially isolate. We find ourselves now under the microscope of everything being observed and our behavior that could cause another riotous outbreak, that could cause condemnation on our police department. I have officers who are faced with criminals who are locked up 1 week and back out the next. We're in a tough situation. And now more than ever, yes, we need those relationships that we've built up with the city of Springfield. We need those community leaders and organizers and politicians to come out and back us. We need your help. We have tried and will try to do the right thing by people and weed out officers who do not fit that criteria. But if you're in public office, if you have a say in your community, if you have a religious standing where people listen to you and look up to you, we need you more now than ever to say that violence and further violence is not the answer. This is a great time in our country to have a great conversation about police training and to somehow unify it. It's broken up throughout the country. Different police departments require different training. Now is that time, more than ever, to say let's all get on the same page and get together as a country to start doing the right thing with law enforcement and law enforcement training. What happens in these peaceful protests is people who are not looking to be peaceful at all, people who are looking to be antagonists, people who are looking to commit crimes, infiltrate the peaceful protest to turn it into acts of violence. And it turns the police department and law enforcement against what looks like the protesters. But it's not your local people who are trying to be heard that we want to turn against. It's those who have infiltrated that are out to cause problems to keep this riotous environment fueled. And we don't want to keep it fueled. We want it to calm down. We want good progress to come out from a really terrible situation. So we need your help. I need the help of politicians. I need the help of community leaders. I need common sense to take over and calm everything down so we can go back to making positive changes and meaningful conversation. Thank you so much. Thank you, Mayor, for you do that on a constant basis, and we need everyone to chip in here and help us. Thank you.
Thank you, Commissioner Clapprood. Well put. I believe it was NPR earlier this morning that had reached out to me. I've yet to get back to them, but they had asked, and I know the Commissioner and I will respond as far as the diversity of our police, and I'll bring up our fire department. Our fire department, there's parity. I think we're the most diverse fire department in the Commonwealth of New England. In the police department, I believe there's nearly parity now. We are the most diverse police department, from what I understand, in the Commonwealth of Massachusetts, and if not in New England. She speaks about national training. She is so right. We do de-escalation training and other trainings. To our surprise, found out some years ago, that's not nationally done. Now, am I perfect? Is Commissioner Clapprood perfect? Is our brave and dedicated men and women in blue perfect? No, and I stated that in the letter. But we strive to continue to work together, and I think it was Mass Live that reported that one of the protesters who was trying to agitate things in front of the Springfield Police Department was arrested later that evening in Chicopee, the Walmart. They were trying to get in there to loot it and rob it. They broke in. So all it takes is one or two bad apples or more than that takes away from that peaceful protest, about the cause, about the respect of George Floyd. And as Helen indicated, the things that have occurred prior. Now is the time. And it has to come from the national level. Everybody on the same page. What we saw with Mr. Floyd was atrocious. Just the non-humanity of that. Why someone did not step in over a $20 bill, make an arrest warrant, give a summons. That goes to poor training. And everybody knows how I feel about public safety and men and women in blue. And now everything is festered up, and it has to be dealt with. So we'll continue to build on our relationships even when we don't agree. And I think once we can continue to keep sitting down, and Helen had mentioned, we've had a number of meetings prior. Many are closed door that we did. Helen's involved in those with clergy and social activist groups. And I believe a mutual respect has been built. We don't agree all the time. I find out things I didn't know. They find out things that they didn't know that our police department has to deal with. But there needs to be a national healing. This is really, I can only imagine how the families of George Floyd and the others who have lost their lives and officers not acting correctly feel. But Helen said it, and I think Cheryl said it. You know, you're dealing with the COVID-19, you're dealing with the coronavirus, and this hits you too. Because we love and care about our city and about our people. And we don't want to see that happen here. So what's right is right, what's wrong is wrong, and if something's wrong, we will call it out and deal with it. I'm sorry to wax on a bit there. I don't know, do we still teach philosophy in high school? I know in college. So with that, I'll give the entree here to our Superintendent, Dan Warwick, and he and his team have done a tremendous job, and Superintendent Warwick, Springfield Public Schools, will give an update. Thanks, Dan.
Thanks, Mayor. Good morning, everyone. So on our meals program, to give you an update, we went over 954,808 meals on Friday. We delivered 74,292 for the weekend. Again, we have 17 sites all week, and then Central on Friday, and the program continues to grow. We're going to go over 1 million by midweek this week. So tremendous job to the Springfield Public School staff and our Sodexo, our lunch provider, providing that need. And what they started last week was providing boxes of produce for families at certain sites. Every year with the program, we've not only tried to improve the quality of the program, but also look at the nutritional value and increase the nutritional value. So very proud of what they've done. My team has spent a tremendous amount of time planning 8 virtual graduations, which are going to occur over the next 2 weeks. They're going to occur at 6 o'clock, Monday to Thursday, for the next 2 weeks. We're going to have them on Focus Springfield, Channel 15, and we're going to stream them out from our website, www.springfieldpublicschools.com. So they'll be available for everyone to see. In addition to that, my high school principals put together a live program for their kids where they could pick up their diplomas, dress in their cap and gown, get a stage experience and pictures with their family. So the staff has put a tremendous amount of work into that. The senior rites of passage are very important to our students and their families. So my staff has worked very, very hard to provide the best possible scenario for our kids and their families while making sure we're providing a safe environment. This summer, Springfield Public Schools is going to offer a virtual summer school program. We decided, given the safety, that more parents would be willing to participate and more staff if we were operating remotely. As you know, we've talked about this before, but we have a one-to-one laptop policy in the school system. We've passed out over 17,000 laptops to students, and we're going to keep those laptops out for the summer and actually provide a significant summer program. So all of our traditional summer programs are going to operate. Our credit recovery for the high schools, our elementary programs, our basic skills. But in addition to that, we put an extra $250,000 into offering an enrichment and basic skills program available to all of our students to keep kids engaged over the summer. Thank you.
Thank you.
Thanks, Dan. On the DPW front, Director Chris Signoli is here, and again, he continues to work with Tim Sheehan and Eddie Pakula on the restaurant reopening. But, to all the men and women at DPW, trash is still getting picked up. Recycling is still getting picked up. Yard waste is still getting picked up. I know he's got the street sweepers starting out and about. Construction work is still going on. So sometimes we take things for granted on the frontline providers, but DPW's done a tremendous job. Without further ado, the Director of Department of Public Works, Chris Signoli. Director Signoli.
Mayor, thank you. With regard to DPW, I have 2 employees that are out now related to COVID. As the mayor mentioned, construction activities have really increased in the city over the past week or two. Bay and Berkshire, major Mass DOT project is starting as well as our paving programs throughout the city. The Tapley Street facility opened last week. By appointment only, went extremely smoothly. So if people need to get into Tapley for building, code, DPW, retirement, engineering, it is by appointment only, and those numbers are available on the city websites. As the mayor mentioned, we are working this week through the governor's orders with regard to restaurants to be able to work with as many as possible to not just have their footprint of the building open when the governor so allows, but also to be able to maximize space around them to be able to get outdoor dining. We are working on those regulations this week, and we know that the governor is going to be issuing his executive order today with some additional information that was put out from last Friday. So hopefully during this week, additional information we'll be able to share with more restaurants in the city, working with Tim Sheehan, Ed Pakula, Helen and Tommy Ash in the mayor's office to get those regulations out. That is it. Thank you.
Thank you, Director Signoli. And again, yes, anything we're doing is public health focus number one, Helen, on that. And if anything with Parkland's area, Pat Sullivan, too. My Chief Development Officer, Tim Sheehan, and again, I can't thank he and his staff enough when I said, hey, we got to do something for our businesses, and found the money to do 2 prime the pumps, and we're hoping to do a third on that. And then, geez, we need to help our residents that are struggling, our homeowners, and how can we help them out? And through Tim's work and his division, $2 million to help people who are struggling with their mortgage, their rents, and their utilities. So I'm very proud of what my cabinet heads in rank and file. We have taken a lead on many of these things in Western Mass and even sometimes in the state. So without further ado, the Chief Development Officer of the City of Springfield, Tim Sheehan.
Thank you, Mayor. As we're reopening in a new normal that's far different than the normalcy that we had in early March. The Economic and Community Development Division is actively working on programming that addresses 3 fundamental areas. One, obviously, is dealing with small businesses in how they are responding to the reopening orders and dealing with the public safety issues as it relates to the virus. And we're most likely going to be able to do another grant round that addresses assisting small businesses with those costs. The second component is dealing with housing security. Obviously, the virus has taken a severe economic toll. As the mayor was indicating earlier, the level of unemployment that exists in Springfield has been at an all-time high, and the economic distress that's in our neighborhoods and in our community as a whole is significant. So one of the issues that we want to ensure is that no Springfield resident ultimately is losing their home due to the economic impact of the virus. And the third component is ultimately looking at the reemployment and the workforce development issues related to reemployment. Those three areas we're going to be coming forward through the CARES Act and ultimately implementing programming to deal with all three components. And again, what we're trying to do in terms of the programming is to make it as simple as possible from a processing standpoint, and to be highly flexible so that we can respond to the conditions on the ground as they change. Thank you.
Thank you, Director Sheehan, and our major conduit, he's always there for us, is Congressman Neil Ritchie, Chairman of House Ways and Means. We speak all the time, and when Tim speaks about facilitating some flexibility with some of that HUD and CDBG money, especially on the prime, the pump aspect, we're working on that, and we spoke with the Congressman Neil Ritchie Friday when he brought money home for PVTA at Union Station. And they're negotiating now on that fourth stimulus plan, which would go directly to our states and more importantly, our municipalities, cities. And you know, he being a former mayor, once a mayor, you always have the heart of a mayor. He understands and he gets it. And then with our relationship with our delegation and obviously Governor Baker, Lieutenant Governor Polito, we're hopeful some of that money can come in to help us get through not only FY20 but FY21, and strategically plan to move forward in FY22 and FY23. So with that, I gave you a little brief on the legal update with Solicitor Pakula and Human Resources Labor Director Bill Mahoney, and Finances CAFO TJ Plan. I gave you that. So as usual, I'll open it up to questions of my cabinet heads, myself, whether Sarah, Mike, Matt, if you have any, Paul, any questions of each and every one of us. If not, again, I want to thank the TV media, the radio media, the print media that are here or watching now for continuing to get out our information. It is so vitally important, not for us, but for the people who read, listen, and view, so they know where to go when they need help, because we're in the business of giving help and doing whatever we can within reason. So if there's any questions, Paul? I'll have Helen and Tim come up. We're going to continue to keep it up, and they can speak that we're working on a transition plan with the Friends of the Homeless and the CSO that deals specifically with the homeless thing. We had to do what we had to do, and I'm glad now people see why I ordered it a month ahead of time before everything happened. We've been able to keep our numbers extremely low. Who have, I think, nearly 200 tested, and I think there was possibly, I think there was 9 that tested positive. But let me bring up Helen Carlton-Harris and Tim Sheehan, but we're hopefully working, and I want to thank Springfield Technical Community College, President John Cook, because when I made that phone call, without hesitation, he was able to get us there.
So the situation at the tent, we are meeting with the homeless providers beginning next Thursday to develop a transition plan and at least understand what resources are available for the homeless population, so that we're not We're continuing to care for those individuals, but we will be developing a transition plan. Currently, there are less than 5 individuals in the structure, is my understanding, and so we have kept the numbers at a very manageable place with our partners, Community Support Options. And again, we'll have more information on that on next Monday. Tim?
Tim? Thank you.
The tent was always meant to be a temporary solution to the problem as it was quickly coming at us. Now we have an understanding that the virus is going to be more of a long-term situation. I think that there's an understanding that there needs to be more of a structured facility to deal with the quarantining. We're trying to figure out how that ultimately can be done and how it can also help in terms of depopulating and reducing the amount of people that are homeless people that are in one facility at a given time.
Any other questions pertaining to the homeless, or Director Sheehan and Commissioner Fulton? Harris? Sure.
In last week's data that was
Helen, you want to come over so they can hear?
in last week's data that the state released on community numbers, they showed Springfield having 2432, which is well above what the number was as of Wednesday. And of course, they used to be reporting 2400 in the city. Have you reached out to the state or where is discrepancy? And if there's any, I mean, it's last week's data is going to be updated this Wednesday anyway, but I mean,
Yes, when the Commonwealth first started keeping the data, when they ran the data reports and gave them to the cities and towns, and I know the city of Springfield, there was duplication. And so what I did was go through each one of the lists every day and take out the duplications. I'm assuming that the Commonwealth is reporting the original raw numbers and did not do the scrubbing necessary in order to just have the numbers for that particular day. So I think that's where you're seeing the increased numbers.
And Helen did bring that to my attention more than a few weeks ago, that we're going to stick, we knew our numbers were concrete. So that's no negativity of it. I think Helen scrubs the list. That's why that's all these things, we want to get direct information.
and I know there's been some, generously, some mistakes made on some state data, that's why I wasn't sure if there was a,
Yeah.
where the discrepancy was.
And that's why I indicated to the mayor I was going to stay with our numbers. There may be a point that we do a reconciliation in terms of the data from the state and what we have, but that will not happen until I'm able to concretely understand that those duplications were taken out, and I do not think that they were. And I think that's why you see the increased numbers from the Commonwealth.
And I want to thank Helen, too. She took the time to break down, God rest their souls, on all the deaths, because we wanted the breakdown, the ethnic breakdown of it, and she scrubbed the list in her department at all, and I appreciate that. Any other questions or comments? Sarah, Mike? Go, yeah, no, go ahead. That's what we're here. We appreciate. Yeah.
My understanding that Governor Baker has said that like Saturday,
Yeah.
announce whether we move into phase 2 on June 8th, which would allow the restaurants to open for outdoor dining next Tuesday and Friday. Is the city going to be ready to do whatever it has to do, permits, street closings, sidewalk closings, whatever the plan is, are you ready to go by Monday?
That's what we've been working on with my team, and this is a extraordinary time we're living in, and I told my solicitor, Ed Pakula, if I have to, I'll issue executive orders. We're trying to work internally. We're all about fast-tracking it, streamlining it, even to see, I know we're still waiting on the state level, the ABCC, on the liquor, alcohol light. We're trying to see what we can do. So we want to be ready to go. The Governor Baker, it's a good plan. I think he can, he's a numbers guy. So he's looking at those public health numbers. And who knows, maybe there could be, before even phase 2, there could be some type of transition besides exterior, outdoor, al fresco dining, maybe the interior, we don't know. But right now, we feel strongly, and he has indicated that you're gonna see al fresco, no matter what, I think, unless something changes drastically. So working with DPW Director Chris Signoli on the streets. We also are working with Commissioner Clapproot and Commissioner Calvi. We have to make sure, God forbid, if there's any public safety issue, we don't want it, any issue, but that they're able to get in and out of there. Obviously, health is number one with Helen. The economic business impact with Timmy. The legal clearance is always with my solicitor, Ed Pakula. And if there's anything, and then we're going to work with the business community. We're reaching out to the business community restaurants. Some we've already spoken to. Some might be elated about closing streets. Some might not. Now, if any parkland comes into play in certain areas, we're working with Pat Sullivan, too. So I guess the old thing, we're building the plane while we're flying it right now, because we're waiting for concrete. But I believe he's going to, Bill Baker from my staff, my communication director, and he's going to, Governor Baker is going to say something today, but I do believe concretely Saturday he's going to say something on it. So we're going to, it's a puzzle right now. So let's go plan A, plan B, plan C, but we want to be ready to go.
But if you determine, if you determine, for example, use of street closings, what we determine which streets, where, and when will you make that information public?
I think publicly, the Fort has been looked at, Fort Street. I'm bringing Chris up. There has been some talk about Worthington Street, some others. Now, some like that, some don't. So we just told the restaurateurs, and Solicitor Pakula and others are reaching out even the more. Come on up, Eddie. What's your fancy? We just want to get you back open and rolling. Ed?
Thank you, Mayor. Yeah, we are internally discussing the issue, but we want to have a reach out to the restaurants. We want to get input. The standards, I don't know if you saw them, that just came out on Friday, were sort of our first look of what we can expect. There's a lot of moving pieces. There's the COVID piece, there's the alcohol piece, there's the food piece, and they all interrelate and they all overlap. And I'm not sure all the restaurants are even seeing the guidance that was put out on Friday. So we are actually working with our health commissioner, as well as our economic development people, our DPW, our police, our fire. All of those play a role. If I can conceptualize it, what we're trying to conceptualize it as the change of a description of a premises that has been licensed to serve alcohol. And all of the things that we have to look at from that standpoint, from planning, DPW, police, fire, health, we still have to do. But now it's moving into the public way. Now we're looking at sidewalks, we're looking at streets. Adds another layer of complexity. And we've looked at what Boston is doing. We've looked even at what Chicago is doing. And we've looked at what Hartford and Connecticut are doing. We're trying to put them all together. And as I said, and as the mayor said, we want to have a reach out to some of the restaurants from throughout the city. Downtown, 16 acres, Orchard, Mason Square, North End, all over. And we want to get their input. We want to know the problems they anticipate.
Some restaurants have reached out to us a few weeks ago. So that's where we're working with the Springfield Improvement Business District. But when we speak in our meetings, we speak about the whole city with restaurants or mom and pops. How we can get them reopened, or how, if they are open, delivery, how we can get them experience. We want to be able to fast track this, follow all the proper public health, public safety, economic guidelines. So we don't look to be an impediment at all. We want to get them opened, and we're trying to figure out ways, if the state doesn't step forward on the ABCC, whether executive order or what, we're trying to figure out a way on the liquor license, because you have to be contiguous. So I have a great team, they're working on it, and, we want to get them rolling as soon as possible. Any other questions, Mr. Pula? Yeah. Sure, Commissioner.
The mayor mentioned de-escalation training. I know this has been discussed a number of years Can you explain what that means exactly and how it's different from what would have been done beforehand?
What the emphasis is now, Matt, it's on talking to people. They used to call it, there was a course that came out about 10 years ago, I think, and they called it verbal judo. And that course has since kind of morphed into de-escalation training. It's to learn how to talk to people, how your stance, how your tone of voice affects the response that you're getting. And it deals with relating to people and giving people a chance to vent to you before action's taken. It's just teaching the officers that not everything has to be a physical confrontation, and it gives them some examples, it gives them some alternatives to a physical confrontation before that's necessary. So that, combined with, I think, the EPIC training and the ethical dilemma training about watching your partner, watching your own behavior, I think that has set us apart now within the last, especially the last 5 years. Because we know we've had some incidents and we address them, and that's what I find to be very frustrating about this incident, is it's turning into something totally different than a learning experience for law enforcement. It's turning into a riotous, violent confrontation, which it's a shame, because I felt there could have been some real good dialogue here going on between different departments and how the officers are trained.
Any other questions? Sarah, Mike, Westfield Whip, any questions at all? Paul? Okay, listen, to each and every one of you, to the viewers out there, thanks for watching, and thank you for what you're continuing to do day in and day out. As Commissioner Helen Carlton-Harris indicated, it's working. It's working. I know it's tedious. I know it's aggravating. I know that puts a lot of stress on each and every one of us and our families, but again, when you're out and about, wear that mask. If you can, social distance 6 feet. If you don't feel good, stay home. And we move forward aggressively on testing. We're doing the other thing, contact tracing. Please, if anybody's from Helen's shop calls you and working with the state, we're just trying to help you and your family. This information is confidential, and we want to be able to mitigate any type of community spread, isolate it, and be able to nip it right in the bud. And the other thing too, I know it might seem common sense, but continue to wash your hands. Wash your hands moving forward. And our first week of reopening has gone pretty well. It's via appointment right now. We're soon we'll try to transition to phase 2. We miss you too. We like seeing you here in City Hall and our city buildings, but we want to continue to preserve and protect our workforce, which we've done a very, very good job on, knock on wood, and we want to protect you and your families with this health. So all this information, as you know, is on our website. We update it nearly daily for all the contacts that you need or any help that might be needed. But you've been a great partner of the City of Springfield, the residents and business community. And again, I deeply appreciate your patience, your understanding, your cooperation, your collaboration. We're in this together as one, and we need to win this as one. So not only dealing with the COVID-19 coronavirus pandemic, it is a time of national healing that has to occur with the terrible death of George Floyd. So with that, again, on peaceful protest, we welcome that. That's the American way. But to those who want to perpetrate violence and vandalism and mayhem, that will not be tolerated here in the city of Springfield, not only to protect the residents and business community, but to protect you, the people who are peacefully protesting. So we have to make sure that we weed those individuals out. We'll see you next week. If anything else should arise, whether good, hopefully good, not challenging, we'll get before you again. And my thoughts and prayers to each and every one of you for good health. God bless.